let us talk about non-communicable diseases. Number one, we will talk about accidents. Now, the prevention of accidents is further divided into primary prevention, secondary, and tertiary. So, let us get into detail. Now, the primary prevention include safety education. Now, educate people regarding information, proper training, legislation, how to drive, so that they can prevent themselves from getting into any accident. Now, that includes promotion of safety measures, which include educating school children and use of helmets and seat belts. Now, then comes if we can decrease the causative factors which are actually responsible for accidents, that this will also decrease the incidence and prevalence of accidents, and they include improve the roads, improve the lights, especially in the night. Speed limits should be displayed at different areas, especially where there is a population. Danger signs should be displayed. Cat lights should be made available in areas where there are dense populations, especially for the night, and do not allow people with eye and heart diseases to drive, especially at night, because they can be involved in an accident. Now, then includes enforcement of the laws. First of all, ask the people to take a proper driving test. They should follow the speed limits. Inspection of the vehicle by the task force is very important. That first of all, the vehicle should be inspected by a proper task force, that whether the vehicle is capable of coming to the road, because if it is not, then this is the most preliminary stage which can lead to accident. Now, further talking about secondary prevention, they include primary care. Like at the site of the accident, people should be educated about first aid and various other means in which they can help those people who have been involved in an accident. Then comes the tertiary prevention. They include the rehabilitation of those patients who have actually suffered by an accident, and their data collection should be done in terms of research, so that various preventive strategies could be used and people could be educated about them, so that they can save themselves from accidents. Now, further talking about prevention of blindness, it is again divided into primary eye care, secondary eye care, tertiary eye care, and certain specific programs. So let us go into detail of primary eye care first. Primary eye care, they include vitamin A capsules should be given to people, adequate nutrition, specifically those foods which increase the eyesight, which includes carrots, apples, and various other foods. And then periodic examination of the eyes, and personal hygiene and dietary habits should be emphasized. Then comes secondary eye care. It includes proper management of the eye problems and provision of mobile eye care clinic. Now, tertiary eye care is the surgical intervention to deal with the pathologies of eye which has led to blindness. Now, in terms of specific programs, we have trachoma control, because trachoma is one of the most common cause of blindness all over the world, and vitamin A prophylaxis in those patients or those areas where their people are suspected to have vitamin A deficiency. Both of these causes are the topmost causes for causing blindness. So if we can prevent them, we can have a control of these two problems, we can actually prevent blindness. Then comes school and occupational eye healthcare services, which can also identify those individuals who are highly susceptible to develop blindness because of certain other pathology or certain other defect. Now, further talking about prevention of any carcinoma, we have primary prevention, we have secondary prevention. In terms of primary prevention, we have control of tobacco, increase information regarding personal hygiene, decrease exposure to sunlight, occupational measures, for example, in those occupations in which the people who are working in a specific environment are liable to develop carcinoma or any other serious pathology, they should be given proper equipment so that they can avoid the exposure of that particular substance. And specifically, this includes in those workers who work in near radiation or nuclear power plants. Then includes decreasing air pollution and treatment of the precancerous lesions. This is done by screening and sampling. I will explain how these precancerous lesions can be screened and sampled when I will explain screening. And then comes secondary prevention. This includes registration and screening, again as I've told already. And then comes the treatment. And the treatment includes surgery, chemotherapy, and radiotherapy. The treatment of cancer I have explained in the principles of oncology. Then comes certain legislations in cancer education, so that people who have developed carcinoma can have a better understanding in terms of the treatment, prevention, about its passage in the family, because that is also very important in terms of those carcinomas which are present in a family, which runs in a family. So let us talk about the prevention of coronary heart disease. It is divided into population strategy and high risk strategy. So let us go into detail of population strategy first. In population strategy, primordial prevention is done by health education and adopting a healthy lifestyle. People in a community are educated by health teams in order to uphold the healthy environmental activities so that they have a better understanding about how to live a healthy life. Then comes primary prevention. This includes ask the patient to quit smoking, ask them to increase physical activity, decrease salt, decrease cholesterol, saturated fats should be less than 10%, and high density lipoproteins should be more than 30 milligram per deciliter in the diet. High risk strategy is applied in those patients who are susceptible to develop disease in later part of their life. They are labeled as high risk as compared to other people who are at a less risk or less chance of developing coronary artery disease. Now this includes identification of these high risk individuals. Again, this is done by screening and sampling and various other data collection techniques, and specific advice should be given according to the specific condition of a patient. And then comes secondary prevention. This includes again control the risk factors which are responsible in a specific community to cause coronary artery disease. So let us talk about prevention of diabetes mellitus. First of all, let us talk about screening. Screening is done by means of urine glucose test and blood sugar test. Now, blood sugar test is done either by fasting or random blood glucose. Talking about primary prevention of diabetes mellitus, we have divided into two parts, that is population strategy and high risk strategy. Now, population strategy is applied in whole population, and high risk strategy is specifically applied in those individuals who are at a more risk of developing diabetes mellitus as compared to general population. In population strategy, focus is on primordial prevention, which is very important. Ask the patient to have a normal weight in terms of their BMI. There should be education in the community in order to avoid or decrease their risk factors. Now, high risk strategy includes identification and motivation of those people who are at a risk of developing diabetes to acquire a healthy lifestyle. Now, talking about secondary prevention and tertiary prevention of diabetes mellitus. First of all, secondary prevention. The treatment should be based on the diet and drugs. Self-care should be advised by adhering to the medicine. HbA1c levels should be done on regular basis to assess the damage that is going on in the body. Home glucose monitoring should be advised, and routine checkup and follow-up of the patient should also be advised, and also the eye, blood pressure and kidney checkup should also be advised. Tertiary prevention includes establishment of diabetic clinics, data collection in terms of research so that more preventive strategies can be made, and establishing record for the diabetics. Now, talking about prevention of hypertension, it is again divided into primary prevention and secondary prevention. Primary prevention includes population strategy and high risk strategy. Now, the primary prevention for hypertension includes health education, hygiene and healthy lifestyle, decrease smoking and avoid alcohol, decrease salt intake and fat intake in the diet, decrease stress and decrease weight, or rather acquire a normal BMI. Then the most important thing, increased physical activity. Now, hypertension in pregnancy should be checked in antenatal clinic because hypertension in pregnancy is associated with causing preeclampsia and eclampsia, which are emergencies in gynecology. Then comes high risk strategy, which is to identify and motivate those people who are at a greater risk of developing hypertension. Then comes secondary prevention. Secondary prevention includes early detection of high blood pressure, their proper treatment, and patient compliance through education. Now, further talking about prevention of obesity, first of all, we should have an understanding on how can we assess obesity. There are different parameters. Number one is body weight, and then comes the skin fold thickness. Now body weight can be calculated by BMI, which is weight in kgs divided by height in meter square, and then we have Broca's index, which is ideal weight is equal to height in centimeter minus 100. Now skin fold thickness is measured by her Benden skin caliper, and it has certain parameters in which we compare different age groups and genders in terms of their skin fold thickness to label them as whether they're obese or not. Now once we have labeled someone as obese, we can have a prevention of that to help that patient to come back to normal BMI, and that includes dietary changes, and they include decrease overeating, decrease fat from the food, or increase fiber in the food, increase in the physical activity, and eventually we have our last resort, surgery. Now surgery, there are different surgeries which can be prescribed to the patient so that they can have their part of stomach removed so that they can have less eating, and less eating will eventually lead to less weight, but definitely the surgery comes with a lot of complications. Now further talking about prevention of rheumatic heart disease, we have primary prevention and secondary prevention. In terms of primary prevention, the aim is to prevent the first attack of rheumatic fever to ever occur in any patient. Now, whenever a small child develops throat problem, their swabs should be taken to have a proper diagnosis and proper treatment, because if the treatment is not given, then that child is highly likely to develop rheumatic heart disease. Now, high risk ages, the school going children, they should be properly educated, their parents should be properly educated. Now, what is the prompt treatment? This includes 3 lakh units of penicillin, 3 lakh units of procaine, and 6 lakh units of benzyl penicillin. Secondary prevention include aim is to prevent the recurrence of rheumatic heart disease, and proper diagnosis is also very important in this as well. Now this treatment now will be 1.2 million units of benzyl penicillin for adults and 6 lakh units in children every 4 weeks. Lastly, talking about prevention of stroke, in terms of primary prevention, the risk factors should be decreased. In terms of secondary prevention, early diagnosis through CT scan or MRI should be done, proper treatment should be given, and health education. Health education is educating the people that they can have a much better understanding about the disease and they can manage with the complications that has occurred or are likely to occur. And then comes the tertiary prevention. That includes rehabilitation of that patient so that they can again come back to their normal life and they can start their work. So thank you very much for your patient listening.